Hello and welcome to Changing World. My name is Anthony Smith. We are, unfortunately, today facing a global crisis, a pandemic which is currently having a dramatic impact on our society, not only in terms of deaths, but also the devastating effects on the economy, with millions of people not able to go back to their work routines due to social distancing rules. The coronavirus was first reported in Wuhan, China, around the end of 2019, but has since spread rapidly across the globe. Joining me today is a gentleman by the name of Dr. Deane Waldman. Now, Deane Waldman was originally educated at Yale University, followed by training at Chicago Medical School, then later studying Pediatric Cardiology at Harvard. He became a renowned pediatric cardiologist for 37 years, up to his retirement in 2012. Now, Dr. Waldman has also studied systems theory and has written a book entitled Curing the Cancer in US Healthcare. So, welcome, Dr. Waldman. How are you today?
I'm very well, thank you. Shut in my house, but well.
Right, well, I'm glad to hear that. Now, obviously, we're dealing with, a topic which has had so much impact around the world for whatever reason, and that's this coronavirus. Now, the coronavirus has been getting constant attention by the media, as you're aware. As soon as you turn on your TV, you're likely to hear some news about it. But I'd like to ask you, Dr. Waldman, what is your take on the media coverage? And is it taking over our society to the point of putting the population in a state of fear or unnecessary panic? What do you think about that?
I definitely think it is now mass hysteria, so I concur with what you're saying. Let me start out by, talking, making sure we all have the same language. Coronavirus is merely a general term for a number of viruses that actually look like they are structured like a crown with the little spikes on the top of it, the way a crown would have those spikes. So there are a number of coronaviruses, including SARS and MERS back in previous pandemics, including the common cold. Secondly, the term COVID-19 stands for Corona Virus Disease, and it is started in 2019, and therefore it is COVID-19. So that shorthand is what we use. I just want to make sure everybody understands what we're talking about when we use these terms, COVID and so forth.
Okay.
Now, the hysteria, clearly, in my view, it was, this is sorry for double negative, not inappropriate early on. By that I mean, when it first spread, it spread really quite dramatically, and it went from probably one or two index cases in Wuhan to thousands, we don't know, possibly hundreds of thousands in China fairly rapidly, and then spread throughout the globe. So suddenly the people of Earth, if you will, are looking at this thing going, well, we don't know what it is, but it sure as heck is spreading like wildfire, exponentially in Italy, in South Korea, in this country, in Great Britain, Spain, etc., and certainly China, although we have learned that the numbers are frankly manipulated from our friends in China. So I don't know what to do with those numbers except take them with a grain of salt, or since I'm a cardiologist, salt substitute. All right, so we had this panic that started in, let's say, late December, early January of 2020, and certainly our administration sees this explosive growth and hears from our experts, well, as many as 2 million Americans could die as a result of this contagion. And so these draconian activities were put in place, draconian measures were put in place. And frankly, Italy felt the same way, South Korea, your country, etc., all saw this thing and said, well, we have to really cut down on travel because the vectors of disease are coming into our countries. Number two, we have to distance our people from each other so we can reduce the contagion that is taking place. And then people began to realize, well, people get sick with this, and we don't have the resources to handle the number of ICU beds or the number of ventilators, or quite frankly, our country made a very big mistake with masks. We had a stockpile of masks, over 100 million masks in 2008. And in 2009, we used that stockpile for the H1N1 epidemic that we had in 2009, which, by the way, targeted children, whereas this one targets those with serious illness, chronic lung disease, pre-existing conditions, if you will, serious medical pre-existing conditions.
Yeah.
Anyway, we didn't replace our stockpile. Now, before this broadcast started, you made a comment to me about, well, we couldn't have predicted this contagion. And I would argue actually quite the opposite. We have had viral epidemics, and specifically respiratory viral epidemics, every couple of years for the last 20 years. So we should have anticipated this thing. They call this a novel coronavirus, but the fact is it's not terribly novel. It attacks people. It's a respiratory virus. It attacks people who have weakened lungs, whether you're a smoker or you have chronic lung disease or you're an asthmatic or you're somebody who just, one of the teenagers, I wonder if the vaping that our kids did damaged their lungs and caused them to be more susceptible to this virus. Bottom line is, the panic was, I think, or at least the fear was, I think, reasonable early on. I do think that our media, and I really don't know what to say about other countries because I haven't been following other countries, and you're going to have to tell me, but I think our media overplayed the danger.
Well, yeah, I mean, I can understand exactly why you say that, because obviously you've made it clear that there are different ways of handling these things, and I think what the media has done is, wrongly or rightly, it has created a lot of fear, a lot of panic behind the scenes. People may be a bit on edge, generally in the community.
More than a bit on edge.
Yeah. So what I'm getting at is that the whole media aspect of it has created a lot more panic than ever before, as far as I can tell.
See, part of the reason I believe that this happened, this media frenzy, I think part of the reason was that our advisors, medical advisors, simply said, okay, let's take the worst case scenario and put it out there. And one of the things that I have to fault our people for is the following. we didn't have contingency plans in place for the last, 15, 20 years. We didn't play war games the way the military people did. We, by that I mean the medical people, didn't play war games. We didn't say, okay, if another SARS is severe acute respiratory syndrome, okay, well, okay, it hit a different subpopulation than the COVID virus, but the fact is it is a severe respiratory acute illness that happens during flu season. Well, we should have said, all right, now how should we respond in peace and quiet, not during a flu season time? In other words, in June or July or August of 2 years ago, 5 years ago, they should have sat down and said, and here's the second part is really important, how should we respond medically when the next one comes, as it certainly will, and how should we respond fiscally, politically, which nobody has, nobody did that, and then suddenly we are faced with this crisis and we're playing defense, we're playing catch-up ball, and nobody calculated the cost in terms of devastation to the world economy.
Yeah.
Or want to just talk about our country, just to our country. The cost of, for example, somebody would say, let's do social distancing. That's the way to stop a virus. It happens not to be the way, but let's just say they did a contingency plan. They said, okay, well, one way to handle this thing, because it's contagious, whatever it is, whatever name we give it, let's separate the herd. Let's separate people so that if they're not in contact, they can't transmit the virus, and that way it will slow its spread. Fine. What is the financial and other medical costs of our doing social distancing? Let's model that, but nobody did that.
No.
And so now we are seeing, quite frankly, financial devastation around the globe in a response to what I think is nothing more than a variation of the flu.
Right.
We didn't do this last year.
No.
We didn't stop the world economy
No.
In the flu season of 2018, 2019, and yet 61,000 Americans died during that flu season. Current death toll in this country from this virus is 6,000.
Yeah. Okay. Right. Well, that's a good point you made there, and I do fundamentally agree with that. Let's now just take a look at a few of the statistics, just to put this in perspective.
Yes.
As of today, the 3rd of April, we have coronavirus deaths in the US of around 6,500. For Spain, the figure is 10,900 approximately. For Italy, we have 13,900. Again, these figures are just approximations. And for the UK, the number of deaths is 3,600. And for France, it's around 5,300. So I think one point we have to accept is that the virus did not spread in a regular manner, an even manner throughout the globe. So, for example, Italy was one of the first countries in Europe to really notice quite a high volume of cases, and also Spain. In the UK, it's been a lot lower than those two, but the argument is that we're kind of behind them in terms of time.
Hopefully not. Hopefully you're below them.
Exactly. Hopefully it will flatten out rather than spiking too high. So, but the theory which we've been told, which I'm only relaying, I'm not saying I'm promoting this, I'm saying the theory which has been related to us by the media is that Italy was one of the first countries in Europe to really notice a high volume, to really measure this high volume of coronavirus cases, and also Spain, for whatever reason, was another one. So what they're saying is that we're kind of playing catch up in England. We're in the UK. We're playing catch up to that, which hopefully the curve can be flattened by obviously doing the social distancing. I know you said it's not the most effective thing, but it must have some beneficial effect. And of course, the USA, people have said that obviously USA being a big country anyway, it would take more time to spread because you've got more landmass. And of course, at the far end of the scale, we've got Russia, because Russia is a huge landmass. And so for that reason, for it to spread all around Russia would presumably take a much longer period of time. So there are logistical reasons why certain countries have been hit harder at any one moment in time. And obviously the idea which has been put forward is principally social distancing, with the aim of flattening the curve, so that hopefully in the UK, for example, we're going to get a far lower spike in the number of deaths occurring in the coming weeks or months. So that's the theory. I mean, let me put it to you in a question. What is your opinion, Dr. Waldman, of the way the governments of the West have handled the situation? Obviously, the social distancing measures we believe have helped. Whatever you may say about this social distancing, I believe that must have helped the situation. But we now have an economic disaster unfolding as a result of people being unable to carry on working as normal. There could also be many businesses going into liquidation and severe unemployment. Now, just to give you one statistic before you come in on the question, 10 million Americans have filed for unemployment within the past couple of weeks.
Yes.
That is a majorly significant statistic. And I must agree with you in the sense that we have to attempt to measure the consequences of the actions which the government have taken, and not just act on. Obviously, the aim has been to try and limit the number of deaths, but at the same time, as you have pointed out, we must make some attempt to measure what the consequences of all of this will be in terms of, as you said, more suicide deaths, or the other case which you mentioned, which was that the coronavirus will take priority over other forms of illness such as heart disease. So that, as you say, there may be people who will get treated for being ill with the coronavirus, but that could interfere with the ability to treat other illnesses, which again could have fatalities.
No question about that, and I would only change what you said from could to will and is harming our people. To start with your question, what about the responses of the various governments? I really believe when we first started in, say, January, we'll say when we really started interacting and seeing the contagion spread. We didn't know what we know now in terms of the case fatality rate, the specific population that was at risk. We did not know that.
No.
So I think we overreacted, but nonetheless, you tend to overreact when you have the unknown, especially a biologic agent. By that I mean an infectious agent. So we around the world saw deaths and went, oh my God, is this another Ebola? Ebola has an 88% case fatality rate. This virus in this country has on the order of about a 1.7 to 2% case fatality rate. So it sure as heck ain't Ebola. But we didn't know what we know now in April. We didn't know any of this in January. So we reacted, I would say in retrospect, maybe overreacted because we did not have contingency plans in place. But I cannot fault our governments for what they did in January. However, I really think that we need to change course. Now, you said, and a lot of people say, well, the social distancing is slowing the virus or is reducing the contagion, and that is true. The problem is that we are not destroying, killing, defeating the virus, and the only way you defeat a virus is by immunity, which is why we need, why we have a vaccine, for example, vaccination for the smallpox virus, which, by the way, has a huge case fatality rate in contrast to coronavirus. Well, we're all, hopefully, all immunized against it so that we have what's known as herd immunity, which means if a smallpox virus breaks out in New York, okay, it can't spread very well because the vast majority of people in the city of New York have immunity against that virus because they were vaccinated. Well, for this virus, we don't have a vaccine. We're actually testing one. I know that they're testing in California and Kaiser, but even so, it's going to be a while before that's available, assuming what they're testing works.
Yep.
So we can't depend on a vaccine. We should use these drugs to treat, admittedly in tests, but the Italian group with, by the way, somebody from South Korea, a physician scientist, started using hydroxychloroquine and azithromycin as a combination. One's anti-malarial, the other is antibiotic, but they seem to have a very strong effect on killing this particular virus. So the early data is actually rather encouraging. There are side effects to these drugs, so they're not a sudden panacea that you can just throw around. Having said that, that should only be used for those who are sick, and that does not solve the problem of killing the virus. The way to kill a virus is to create herd immunity, and that's why at this point I think we should do exactly the opposite of what we're doing, which is let the thing spread in the healthy population, strictly quarantine those at risk. And by the way, I cannot speak for Anthony, but that would put me at risk because of my age, even though I'm a healthy person. I don't have a pre-existing condition. But, if you're 76 years old, if you wanted to adopt what I'm suggesting, which is letting this flow, but strictly quarantine those who are at risk, then I'm going to be quarantined. Okay, I think that's the right thing to do. That will kill this virus. Now, the other thing you mentioned is perspective, and I really have to bring that out. The current death toll in our country, in the United States, is just over 6,000, 6,066 to be precise, as of this morning. Last year, the flu killed 61,000 people, 10 times that number And yes, we're not over this pandemic, but to put it in perspective, I would bet that we are probably not going to have even as many deaths as we did last year with the flu. And yet, what we're doing, and you brought it up a minute ago, what we're doing is taking the whole healthcare system and basically saying, if you've got coronavirus, we're going to deal with you, we're going to treat you, we're going to do whatever we can, and if you have anything else, too bad. And that frightens me for people with kidney failure or heart failure or any other serious illness you want to name. Rheumatoid arthritis, which, by the way, is an autoimmune disease and puts those patients at very high risk for this particular virus. But anyway, my point is, if you have something that isn't coronavirus in this country, you have a great deal of trouble getting care. And I fear that people are going to die for lack of timely care who don't have coronavirus. And so that's something, for example, again, I said to you earlier on, we should have, and we should learn from this experience, we should have specific contingency plans in place to say, well, what if another respiratory virus attacks in 2022? Okay, what are we going to do? What if a virus attacks that attacks only pregnant women? I mean, again, I'm just playing military war games here, but medical war games, and we need to discuss in advance how we're going to handle this politically, how we're going to handle this fiscally, and how we're going to handle it medically, and we're not going to leave heart disease patients out in the cold to die because somebody's got a virus.
Yes, I certainly agree with you on that. I mean, it seems that it can be blown out of proportion, really. I mean, if you've got someone who's got a heart attack, surely that must take priority over someone who may have the virus and may be uncomfortable, of course. But as you rightly said, there are certain other diseases which have fatalities which are not going to go away. And so, obviously it's putting a big strain on the healthcare system. That much we can be sure. But
before you go on, Anthony, I want to make a comment to give you an example. Here in New Mexico, pretty much every year we have a sudden, usually in early January, a sudden explosion of a virus called RSV, respiratory syncytial virus. And it attacks primarily, although some adults, but it's pretty much mostly limited to the children. And every year, my children's hospital here goes, oh my goodness, we have all these RSV patients, and what are we going to do with them? And why don't we have a plan in place to say, in January, we're going to expand our base of beds. We are going to have a whole list of traveling nurses that we can call up so we can help these people. We might take over a hotel and use the hotel as a staging area for these RSV children, etc. Why don't we have those contingency plans? And we don't learn from our past history. When I say we, I mean the medical world. I blame us, okay? Because frankly, I think our political leaders are simply taking their marching orders from medical people. So that they're making these social distancing and so forth decisions based on what the CDC and other people in our country are telling them. And I have to say that they didn't plan for this, and they could have. I really believe we should have had a war game of respiratory viral outbreaks, and what are we going to do if that happens? Last point I want to make is you brought up about other countries. Italy versus South Korea, very interesting, and again, we should learn from this experience. Italy chose early in January, basically mid-January, basically to say, okay, we're going to do a certain amount of testing. We're going to find out what's going on in those people who might be sick. South Korea said, no, we are going to test everybody we can get our hands on. And what happened was they had much better epidemiologic information about where this virus was coming from, where the virus was spreading, where the hot spots were. They, as in South Korea, had better information and therefore had a much lower death rate than Italy did. And I think and I'm not blaming anyone here, I'm trying to learn from this experience to do better the next time. And one of the things we need to learn is to do extensive testing so we get, as soon as possible, we get all the epidemiologic information. Who's at risk? Where the hotspots are? Where we need the resources? What medications might work if another virus comes out? All these kinds of things we could do if we had contingency plans and extensive testing as soon as the you-know-what hits the fan.
Yep. Obviously, you've made a very good point that the governments just didn't seem prepared to address this, and obviously they would have had to take advice from people in the medical profession and also scientists. I think they've mentioned that the science behind it, of the science behind how to prevent it spreading so rapidly.
Well, I want to give while I'm, if you will, blaming, if you will, the medical world, I also have to give us a huge amount of credit. Let's think about this for 1 second, because I'm old and therefore I have some perspective here. This virus started somewhere in Wuhan in, let's say, mid-November. By January 11th, scientists in Shanghai had identified the genome and spread it around the world. The exact DNA sequence of this virus was known, was released on January 11th. So that's basically, call it 2 months from case 0, case 1, to actually knowing the DNA sequence, which means you can develop testing, you can begin to consider vaccination, you can begin to consider drugs. That's 2 months. When I went to medical school, all of this was science fiction. It was so crazy to think we can know the DNA of a virus in 2 months. That's technologically impossible. Well, we did it. When I say we, I mean the medical world. And so I have to say that the technology explosion has worked to the benefit of the people of the world, and I don't want to lose sight of that.
Yeah. Well, yes, that's a point well made, that the medical profession have been working very hard behind the scenes, haven't they?
For years and years.
To do whatever they can, and of course now they've been stretched even further at this crucial time. But I think another point which we might get into perspective, which you have already touched on a little bit, is to make comparisons with other causes of death in society.
Yes.
Now, you did send me some information about that, which I have to hand. And let's just make it clear for everybody listening that the number one cause of death let's take the US, because we're talking about the Western world, and that's a prime example. In the US, the number one cause of death is heart disease. Now, just to pluck out one of the figures, in the year 2017, there were over 647,000 deaths just purely from heart disease, weren't there, in the States?
1,801 a day.
1,800 a day, just to put that in perspective. So that's the number one cause of death. And then, of course, there's other things like stroke, or as you say, kidney disease or organ failure and things like that. So there are...
But there are other ones. For example, we brought up earlier in this discussion suicide. Suicide takes away, I have the number here, I think it's 48,344 people died by suicide last year in this country, in the United States. Now, that turns out to be 132 or 131 a day. And I said to you earlier on, I'm worried that with this economic depression, because that's what it is. I mean, we have suppressed economic development and economic activity around the world. I'm worried that the suicide rate could go up dramatically. And if it does, for all we know, at 132 a day, we could exceed the number of deaths from coronavirus by the number of deaths by our own hands. And that really concerns me. And so, again, this is a cost, a life cost that we should take into account when we do things like social distancing and locking down the entire economy of the Western world. What is it? What was that number? I wanted to bring that one out. Traffic fatalities. 39,000 traffic fatalities in this country last year. That's, excuse me, but that's 6 times the number of deaths from coronavirus that we kill on the roads. We kill ourselves on the roads every year. So I think that a sense of perspective is what we really need to. You were trying to bring that into clear view for the listeners.
Yeah.
And I think that they need to realize that while I don't want anybody to die, in perspective, this virus is killing 1/10 the number of people that were killed by flu last year. Well, maybe we shouldn't now continue this social distancing and this disruption of all economic activity. I have a very close friend who lives in Greece, and she lives on an island, actually, on Andros Island, and she said, the town that they live next to, which is named Gavrion, she said, these people are all going out of business. It's not a question that they're just shut down. They don't have the resources to keep their employees, to keep their supply chains going, etc. And they're literally just collapsing and going out of business. What long-term impact is that going to have on your population, on the Greek population, on our people? It's going to be devastating, and I fear that the cost in both money and lives will not match the gain that we get.
I would be inclined to agree with you on that. There's kind of it's a balance, it's an offset. It's kind of like, if you're going to do things this way, which the governments of the world have decided, then you're going to have to pay for doing things this way.
Yeah.
And we've all, the people have already paid considerably by losing their ability to to do their work in society. We've already paid by seeing a massive crash in stock valuations, and we're likely to carry on paying into the future. Another thing which quite a few experts have already speculated is that in order to foot this massive bill which has been created from a stagnating economy, that maybe the taxes are going to have to rise in the future.
I don't think there's any question that that will happen. And remember, at least in this country, we're going to use debt financing. So we're going to print money, which is going to cheapen the value of the dollar. And oh, by the way, with debt financing, we're putting shackles on our children and grandchildren. And they're going to pay for what we're doing now. And that's why I keep coming back to, I'm not questioning what we did back in January, February, but now we need to reverse course, and we need to allow herd immunity to develop and progress, which will kill the virus. We need to try and treat the patients that really are sick, no matter why you're sick, and work on the vaccine, work on the drugs. And after this is over, we're going to have contingency plans for the next one. Why is this a surprise, Anthony? I look at the flu season from 2018, or the SARS experience, or the MERS experience, or H1N1, or H7N9. These are all viral respiratory diseases that break out in the fall or winter of some country, often China. But I don't blame China, at least in the sense of developing this, because number one, they have the most number of people, and number two, packed together, and number two, they have these live animal markets, which I don't know that anybody else has, but certainly we don't, and you don't.
No.
And it's the live animals that actually have the viruses and spread them to humans.
Yeah, well, I think, most people are probably aware of that particular situation, which does go on in China. Other countries are not quite so severe as regards the way that they treat animals, or the sort of animals that they would prefer to eat. I think it's obviously there is a problem there. In fundamentally in that fact, as you've said, which is that certain viruses can actually make a jump from preying on animals to then preying on humans.
Well, yes, that's true, but I would be a little cautious with the word prey. Right now, you and I, even though we're separated by many thousand miles, we have the same problem, which is the same condition, not problem. We have viruses living right now in our mouths. Everybody does. Everybody on Earth has as few as maybe 2 and as many as maybe 10 or 12 viruses. If they don't cause illness, you and I don't care. And my point is, just because you have a virus or are infected by a virus doesn't necessarily mean that the virus preys on you, that the virus causes illness. And so I think people need to be clear that infection does not equal illness. Frankly, I believe that with the travel that is so extensive around our global economy, the travel from China back to the United States or to Italy or whatever, I would bet that we had this virus in our country before the first documented case, which was in this country, was on January, I think, 20th or 22nd. So that was the first documented case. But I would bet, given how many people travel to or from China to this country, that we had the virus, say, in November here, which means that a lot of people weren't sick but were infected. And I wouldn't be surprised if we had millions of Americans who, if we could test them, would test positive for the antibodies and aren't sick at all.
Yeah, yeah. Well, that's an interesting point, isn't it? That the virus actually can be contracted, and you might not even have any strong symptoms. You might have such mild symptoms.
Any symptom.
Well, yes. I mean, if that's what you're saying, that you could even get it and not have any symptom at all detectable, which is possible. So we already know that certain prominent figures, including our Prime Minister, has caught the virus, and to date, they've not had any harm come to them. It's just been perhaps like a mild cold, or even less than that,
or nothing.
Yeah. So this is part of the problem, that it was probably undetected. It remained undetected for quite some time before.
We still in this country are basically testing anybody who might be symptomatic with the virus, and we are not learning from the South Korean experience that we need to be testing everybody. Well, and certainly in New York, which is probably the number one travel hub in our country, certainly one of the top places where somebody would travel to or from China. So it's not terribly surprising to me that that's a hot spot, because so many people went to or from China in, say, early November, even late October. I mean, this virus didn't suddenly, magically happen on November 17th. No. It probably was sitting around earlier in November in Wuhan, earlier in November, maybe even October.
Right. So just coming back to the point about testing. Now, one thing I'd like to get clear is that let's say the majority of people have hardly any symptoms, then to go ahead and test them, it would seem to be you're wasting your time testing healthy people who are never going to get sick anyway. I would rather suggest that only certain groups in society would need to go for testing, because otherwise it would just be a waste of time testing perfectly healthy people who could easily catch it and never have hardly any symptoms to go with it. So what I would suggest is that, coming back to what you said earlier on, is that you could get certain groups who are at risk with the virus. You could get certain groups in society to isolate, and in the meantime, the healthy people who statistically would be very unlikely to fall sick from the virus could then carry on about their business, going to work, doing the usual chores, doing everything in society to keep society moving and keep the economy moving.
See, I would let me give you an alternative view, although the result is the same as what you're proposing. Suppose we did what South Korea did, and we did it in late January, early February, and we did extensive testing. We might find, or we might have found, past tense, we might find that millions of Americans are already infected, have antibodies, are not sick, and have what we call herd immunity. That would allow us to turn around and say, okay, then we should do what I proposed earlier, which is quarantine the people at high risk, and otherwise let everybody go about their business. Yeah. That would give us the public assurance that you're not in grave danger of dying, because that's what's going on right now. People are terrified that this disease, this virus, is going to kill them, when in point of fact only 6,000 people died in this country from this illness. So if we had extensive testing, yes, it's expensive, but I would turn around and say that's a tiny fraction of $2 trillion, which is what we added to the national debt with this bailout bill that we just passed. So if we could let people go back to work, and we could let the economy and the commercial activity come back through the knowledge that we do have herd immunity.
Yeah, okay.
That's the best scenario.
Okay, Dr. Waldman. Well, I would, sort of suggest that an alternative way would be for the government to put out an assurance to say that if you're in good health, if you're under a certain age category and you don't have any underlying health issues, you should be free to go about your business and carry on. Meanwhile, if you are in a high-risk category, you self-isolate, you do not come into contact with anybody, even if they appear healthy and they do not appear to be carrying any virus or do not have any symptoms, you still self-isolate because you're the one who's at risk. So I would tend to polarize those two groups into the healthy ones.
Frankly, I would like to do just what you said, Anthony. My problem is this. Do you think, given how much fear we have created in the public eye, that at least our public would accept that?
Well, I think it comes back to the point about the media, which we touched on right at the beginning, which I think the media, by being so persistent with this, it's on all the time, morning, noon and night. It's on all the time. It's on your radio, it's on the TV, all about the virus. Now, the problem is it makes people panic, it makes them paranoid.
Yes.
I think that's the word, paranoid. And what would have been a better situation would be for the government to step forward and say, we don't want people to be so worried that they're panicking, that they fear they're going to get it. Statistically, we know that the death rate is 2%. Okay, we want to limit the deaths as much as possible, but at the same time, I think healthy people who are not in a high-risk category should be able to go about their business, do the chores, do their work, carry on as normal, and without coming into contact with any high-risk people. So the high-risk people would have to self-isolate.
I agree with you, but here's the problem. If our political leaders said that, they would have to have our medical leaders support that recommendation. And right now, at least our medical people are still talking about 250,000 deaths and quite frankly, mongering fear. And I think that we need to get other people into positions to speak to our political leaders to say, wait a minute, no, we're going about this wrong. You need to let the people do just what you said, which is isolate the high risk, really make sure we quarantine them for their safety, test whatever vaccines or drugs within that subpopulation, and otherwise let people go about their business. But they've got to, our president or your prime minister has got to have medical people on the podium when they make that kind of an announcement to the public, given what's going on for the last 2 months. They've got to have medical people standing with them saying, this is the reason why it is safe for you to go back to work. This is why it will actually be good for the health of our country to develop this immunity, et cetera, et cetera. Without that medical authority behind our president or your prime minister, they won't be listened to.
Okay, well, that's certainly a point which, must be considered. But, I mean, I would have thought that most people who are in good health are simply going to be getting more and more frustrated, not being able to do their normal routine, being stuck indoors too much, not being able to earn money, and it's a social disruption as well as an economic one. So people being stuck at home, and of course the kids are at home too because the schools are all closed. So it's a social problem.
We're already having reports of increase in domestic violence.
Really?
You think about it for a second. Some parents are stuck at home, and there is, let's just say, tension in the home. Well, they can't get out of the house to go to work, or to go to the gym, or to go hiking, or to go to a social club. They can't do that. Those tension relievers. And there are some early reports saying domestic violence is quite has increased in this country because people are shut in.
Yeah. I mean, let's just come back to this, the way that the governments have handled the situation. Do you think that they have exercised a bit too much power over everybody?
I strongly concur with what you're saying here. I mean, in my state here in New Mexico, the governor has sort of said, don't go outside. Well, my exercise is riding my bike. I race bicycles. Okay. I want to go and ride my bike.
Sure.
What risk am I posing to anybody when I'm out on my bike? I'm not near anybody.
No.
I'm not touching anything. And yet they're saying don't do basically anything outside the house. And my point is what you were suggesting, which is they have almost imposed martial law, which I think is excessive and unreasonable, not to mention illegal.
Right. Well, that's an interesting point you make there, and I'm just, I suppose, just to follow that on is that let's just say, for the sake of argument, something comes down the line in a couple of years' time which is even worse. Okay. Then what are the consequences going to be? Are we really going to be locked down to the point where you simply can't go out, you can't do anything? Because, I mean, it seems like they've already taken these drastic measures, and in our country, you can be fined if you go against these rules, or you can be, or even possibly people imprisoned if they go against the rules. So it is quite severe, and I just think that is it the best way of doing things? As I say, coming back to my point of view would be simply segregate the people into groups of low risk and high risk. If they're in a low risk category, just let them carry on as normal. And that will keep the economy going. If they're in a high risk category, then yes, they should self-isolate and make sure that they do follow the rules to self-isolate. But as far as I'm concerned, I cannot see any good reason why the healthy people who are working people in society and the people that keep the economy moving, why they're all being forced to do nothing at home.
You just said, firstly, I agree with you. Secondly, as I said earlier, the political leaders will need medical support to allay the fear that has been created. But you said something interesting a minute ago about that the government would divide into high risk and low risk, and the government should make sure that the high risk people are quarantined. I would turn around and say, I'm sorry, that's their responsibility, not mine. If they wish to take the risk, then that's on them, not on the government. My point is, the government should not say, we are going to enforce a quarantine on you. The government should say, we are going to set up a structure which will allow you to quarantine. And if you choose to take the risk and be with the general population, even though you've got heart disease and chronic lung disease, well, you're going to stand a 15% chance of dying. That's your choice.
That's another alternative viewpoint.
Because otherwise, aren't you saying effectively you would jail or imprison the high-risk population? And I don't think that's...
Well, in terms of doing what we're doing now, but just allowing the healthy people in society to carry on about their business.
No question.
And that would, I think that would alleviate some of the economic problems which are surfacing and which are only going to get worse.
Firstly, what you just said is true. Secondly, think about it this way, just from the medical standpoint. If you actually allowed the low-risk people to go back to work, we would very quickly develop herd immunity, and instead of flattening the curve or suppressing the virus, we would kill the virus.
Right. Well, yeah, I mean, I wasn't quite so sure about that particular point.
If you develop immunity, the virus cannot hurt you, cannot infect you.
Yeah, well, that's what I mean, it was a similar argument to me saying, let the people who are healthy just carry on and not be so concerned about the distancing rules between one healthy person and another healthy person. But yes,
Agreed.
But alternatively, always be concerned about the distancing rule between one healthy person and one high-risk person, because that would be the way that it would spread. But what I'm agreeing with you in terms of the fact that healthy people will develop the immunity. We know that. I mean, our Prime Minister, Boris Johnson, has just, a few days ago announced that he had the virus and he's fine, and he's giving conferences, speeches every single day. So,
and he's one of the millions that will, by their own immunity, kill this pandemic.
Right. So what I'm saying is, I think you're basically agreeing with my suggestion, is that all the healthy people should be allowed to carry on and do their work, do their normal chores, just lead their lives in a completely normal way, apart from interacting with anyone in a high risk group. And that's the way I would put the plan, in that sense, that really, I think it's doing so much damage to the economy.
The price we are paying around the world, both in terms of money, but also in terms of lives, I think is excessive. And so therefore, I actually have this article coming out entitled Time to Reverse Course on COVID-19. And what it says is basically what you're saying. Let the healthy people interact, go back to their normal lives, develop herd immunity, and meanwhile protect by isolation those people who are at high risk.
Yeah.
That's simple.
I think it is simple, and I don't know why the government...
Sure you do. No, you do.
Well,
the media has created a narrative that is frightening everybody.
I don't disagree with that, no. As I said before, I really think it's been overdone in terms of media hype. And, it comes back to people getting a bit overly paranoid.
Well, I'll tell you one other opportunity cost that's going on here. We initially, you and I, were going to talk about my book and what I think needs to happen in terms of restoring our healthcare system. Forget coronavirus. Well, you and I couldn't talk about it today. And why couldn't we talk about it? Because no one wants to hear about anything except coronavirus, because the media has created this, frankly, the word is panic.
Yeah, well, it's a frenzy, if I might use the word. It's a frenzy, I mean, I think we're all guilty of it. We want to know what the latest is. So you go and you turn on your TV set and say, I remember what happened yesterday, but what's happening today? What's the latest development coming out? And it's human nature.
Like a football match.
Yeah.
And you want the latest score.
Exactly. It's just human nature, and there's nothing wrong with that. That's the way our brains are wired to want to find out, to be inquisitive, aren't we? So, I just think, in essence, I'm agreeing with you. I'm saying that what I think should happen is that, like you said, we get some medical support from the experts who could say herd immunity is an important factor in all of this. And in order for that to complete its natural course, we must let the healthy people move about in society as normal while protecting those high-risk groups. So the high-risk groups will have the same guidelines to isolate and to avoid contact with people, whereas the healthy people, the ones that are in jobs, in work, can go about their business as normal and keep the economy going and alleviate some of these problems which are just surfacing and are only going to get worse. And
if there's a message that I would like your listeners to take away from this, besides all of the stuff that we have discussed so far, it is we have to stop being so fearful, because the risk to you, to me, or to my next door neighbor is so low that we should not be in this bunker mentality, shut in our homes, afraid to talk to our neighbor, afraid to go to work. We need to say, wait a minute, by putting this in perspective and understanding what's really going on, we don't need to be in a panic. We don't need to be hysterical. We, the people, don't need to be in a panic. And yeah, we ought to be able to go back to work, and we should lobby our leaders to say, hey, now that I've looked at everything and you've looked at everything, let's go back to work. Let's quarantine or offer quarantine, strict quarantine to those people at high risk, you know, people in nursing homes and people on dialysis machines and certainly the chronic asthmatics and the people who've been smoking for 20 years, which, by the way, one message I really would like to leave people with is you want the best protection against these respiratory viruses? Don't smoke. Don't vape. Don't harm your lungs.
Right, right. Well, that's a very important point and an obvious one which a lot of people have overlooked. I mean, when I do go out, the occasion when I need to go out and buy groceries or something, I do still notice people standing around smoking. And you think to yourself, that can't be doing them any good on any level.
You think to yourself, they are setting up themselves for the next respiratory virus.
Right, right. So all these things really have to be considered. And as I say, we need to get to the point where we can say, where the government comes out and says, healthy people are at such a minimal risk, they should not be worried, and they should not be in a state of fear or panic. Whereas people who are in the risk category, yes, they need to take precautions, and the government will look after them and give them plenty of support to get through this crisis. But as I say, as far as I'm concerned, doing all the testing you like, I don't think that's really the solution. Because for one thing, if you force people to self-isolate for 2 weeks, they're unlikely to be passing it on to anyone anyway. So why bother testing them when the risk has already been lowered? I think instead of focusing on testing, I think they should focus on what you've said, which is, on the one hand, herd immunity, and on the other hand, and at the same time, dividing people into low risk and high risk categories.
I have no argument except that I think the more epidemiologic information we have, I don't want to quarantine. I don't want to test somebody who then turns positive and then quarantine them. No, I'm not saying that at all. I'm saying get more epidemiologic information, because remember I said earlier on, well, I think there are probably millions of Americans who have had and have gotten over an infection, no illness, an infection, to know that that is true.
Yeah, just let me, on that point, Dr. Waldman, I would say to you that I think that's almost certain. I think that's almost certain.
I'm a physician. Almost certain ain't good enough.
Okay, well, we're not going to argue on that one then.
Okay.
Right, well, anyway, it's been very nice talking to you, Dr. Waldman. And, I hope that's given our listeners something to think about and to try and put the whole situation into a bit of context and, to try and reassure people that things are not as bad as you might be led to believe by the media, because at the end of the day we have to look at statistics, and statistics tell us that it's no more than 2% fatalities
And even that is in high-risk people. If you are a healthy person, the risk is considerably less than that. I'd like to put in, before we leave, a plug for my book, because at the end of the day, 3-4 months from now, we're going to look back and say, what the heck did we do? We really overreacted. Let's get back to life. And when we do get back to life, we're still going to find ourselves with a medical system here in the United States that simply doesn't work. It's inaccessible and unaffordable. And since you're stuck in your home right now, why don't you get to think about something else, Mr. Listener, Mrs. Listener, and read Curing the Cancer in U.S. Healthcare and start thinking about, well, what should we do about our healthcare system beyond this coronavirus temporary condition that we have now, which isn't that big a deal, but we still have a healthcare system that is failing and driving us into the poorhouse. Our system. We spent $3.6 trillion on healthcare last year. Okay, that's almost the economy of Germany, the entire economy. So, excuse me, we got to really think about. And you're stuck in your homes, ladies and gentlemen. So, read a book on something that isn't coronavirus and begin to think about what the heck you're going to do when you can get out of your house and when you can lobby your congressmen or your legislators for, we need to change this system because it sure as heck does not work.
Right. Well, on that note, I'd like to say thank you very much, Dr. Waldman, and thank you to everybody who's been listening, and we'll speak to you again. Thank you.